the hamstring stretch position, coming up and down, up and down. You can add dorsiflexion into it. If they're a little bit more advanced, we can add some hip adduction and internal rotation of the hip into it. You need to be thinking about the irritability, what you're trying to accomplish with what you're doing, how bad the symptoms are, which nerves you're wanting to treat. You might want to add in some plantar flexion if you're thinking that it's more peroneal nerves, a little bit of inversion if the sural nerve, if you're having Achilles tendinopathy. All of you should try at least a set of 30, 40, 50 of these guys, and then step down and see if you feel a little bit looser. So that's so add in those variations, the plantar flexion inversion. So then you can do the exact same thing as a leg swing. Come over. So now we've added a little bit more velocity to it. Athletes, runners, football players, cyclists even. You want to be thinking about these things. So we've got a little bit of adduction, dorsiflexion. It's important to work. I encourage everybody to work bilaterally, especially if you think there's spine involved. And the reason that is, one, your muscle tone on one side is going to follow the other. So if you really work like this gentleman, Tad, I worked on his left side. I bet if we would have done right side, it would have even improved a little bit without me even touching it. So you can get improvement on the contralateral side by working the good side. So if they are too irritable to work the bad side, work the good side. The other reason working the good side is important is because nerve roots attach to both sides of the spinal cord. If you pull on one side, this is mainly with spine, if you pull on one side, you are going to affect the other side. If they are too irritable, if it is just too painful to do anything with the left leg, work the right leg. You are going to do something on the left leg. Either decrease the tone or actually get some gliding of just the nerve roots. And it might be enough to get to from, I can move the right leg, now I can move the left leg. Does that make sense? Okay. I hate demonstrating this one. I call it the stripper pose. So some of you asked me about femoral nerve stuff. So if you want to be a little bit on the aggressive side with the femoral nerve, you can do. So that is slacking and slacking the proximal, tensioning the distal, or you can do it the other way around. There's that one. I can't believe I did one for you. Should have been some names. Okay. I figured. Don't give it to my kids, man. All right. Let's practice.